All the talk recently about doctors getting burnt out and leaving medicine and what that means for the medical community as a whole, I want to talk about things we can do, especially as women in medicine, to help protect ourselves from that. Because while anyone can get burnt out and decide that medicine is just not something they can sustainably do, I think this actually disproportionately affects women in the field. Because it's true across society, but also in medicine, that people just don't tend to respect your boundaries and your time as much as your male colleagues. And medicine already pushes a lot of boundaries, pushes a lot of expectations of your time. So women in medicine in particular, I have noticed, just tend to spend a lot more time doing the same tasks and just getting asked to do a lot more than a lot of their male colleagues. And it's not just about protecting yourself and your wellness. You also need to be able to protect the time that you have with patients so you can keep providing the level of care that you need, your expertise, your specialty. It's not just about you, it's also about just doing better for patients. So, the first thing is don't give out your contact information to patients. I know that might sound obvious, but you will be surprised, especially if you're earlier in your career, how often patients will request this of you. And you need to have an answer set. And I say it's just a strict no. Often they'll say that another, insert male doctor's name gave it to them. Or I've even been pressured by colleagues or attendings when I was in training. I had one attending tell me that this was the only way to be a good cancer doctor, was to be available 100% of the time for your patients. And that's just frankly not true. I can assure you that most doctors, especially most women doctors, are not doing this. Partly it's just also not good patient care. They need to be going through emergency lines, going to the emergency department. In a true emergency, you can't realistically be on call and actually available to address emergencies 24/7. Especially for women, patients are just not going to respect your boundaries as much. Now, there's going to be many patients that would, but there will be enough that expect that you are now available at any time for anything. And once you give out that information, you can't pull it back. It's just not a sustainable way to practice. And if you're interested in how to have a long, really fulfilling career, just don't do it. Just set that boundary early. Number two, this is actually from corporate TikTok, but for the women out there, don't do things that you don't see your male colleagues doing. Because unfortunately, again, I wish it was different. Tasks that are seen as more feminine are just not valued. And when you start to do them, people take that to mean internally, they don't even realize they're doing it, that your time is less valuable and you don't consider your time valuable. So things that I've seen women in medicine do that their male colleagues aren't doing: helping clean and organize an office, planning birthday parties, baking, bringing in food. And while all those things are great and lead to a great office environment, I have seen it play out in real life that women in medicine, their time is just not considered as valuable. People see that they're willing to do those things, they start to ask them to do other things. And it can play out in contracts, it can play out in getting promoted, maybe finding more time for teaching, research, or even just for more direct patient care. So if you see that the men that you are working with are not doing something, that they're considering it not worth their time, I would encourage you to think about if it's something that you want to do, if it's something that's not necessary and not actually a part of your job. And again, I wish it was different. Like, I would love to do a lot of those things, but you just have to put yourself out there as a professional that's on the same level as men, because a lot of women in medicine spend a lot of time on all these other tasks that actually aren't related to their job, because it just seems like a nice thing to do, but it doesn't actually help you. It doesn't help you have time for patients, and it certainly doesn't help with your burnout to be doing all those extra things. Number three, we'll stop at three. I think I have like 10 of these. Uh, but it's just, don't be afraid to delegate. Again, another one that sounds so obvious, but I have noticed way more female physicians, and it's something that I struggle with as well, are much more likely to take on tasks that they don't need to do. So putting in orders, calling for outside records, double checking things, following up more with patients on things. And again, none of that's wrong and it's all great to do, but you often have staff that can do it, or you need to be asking for staff that can help, because you need to be seeing patients, you need to be providing your expertise. I mean, that's the thing you trained to do, that's what you went to school and did all of this for, and what really brings you a lot of joy in medicine. If you're spending all your time like working on prior auths and all these other really draining, mind-numbing things, of course you're going to get burnt out. So don't be afraid to ask for help. I know it can be hard. I was a new doctor once too, and going up to nursing stations is very nerve-wracking. They do not treat you the same often as your male colleague, but you just might not make friends with everyone at work, and sometimes you have to accept that for you to be able to do the best job you can and have the most time for the things that are important, that you do have to delegate, and sometimes some people won't want to do it, but you need to make sure that they are helping in their roles to help support you so that you can be supporting your patients. So if you want more of these, I have a lot. These are things I tell all my med students I work with, residents, things that I will talk about endlessly because I truly want to have a long career where I am not burned out, where I'm able to provide good quality care. But it does require some thoughtfulness, especially for women.